All right. We are live again. We're back with another week of Record Live. Zanita, great to see you again.
Thank you. I missed the show.
You almost did. You were so busy doing amazing writing and work, I'm sure.
Yeah, I didn't. I had my times mixed up because I was just getting into researching the topic of today. I got carried away and confused, but here we are.
Well, here we are. We made it. And today's topic is an interesting one. It's actually, for those of you that don't know, we did the teaser as a little bit of mystery. We wanted you to be interested to watch the show because we thought, hey, if you don't know exactly what the topic is, it might just bring some more of you to have a look. But it's a really important topic. And in Australia this week, it's actually National Diabetes Week or National Diabetes Awareness Week. I'm not sure the exact name. And so we thought we would talk. Now, the Seventh day Adventist Church, which we're a part of, does a lot of work in the space of lifestyle diseases and good health practices. And one of those organizations that's very active throughout the South Pacific region is 10,000 Toes. We've got George Kwong today, who is very instrumental in 10,000 Toes across the Pacific, is also the health director for the Seventh-day Adventist Church in the Pacific region, the Trans-Pacific region, based in Fiji. So thanks so much for joining us today, George.
Thank you, Jared and Zanita. Happy to be here. Thank you.
George, we should wish you a happy birthday. I understand it was recently your 70th birthday. Is that correct?
Well, you can see on my forehead and glasses. Yeah. I'm 70. And my children spoiled me on my 70th birthday. I spent the time with them down in New Zealand, and grateful to be in an age where we're getting to see the sunset coming up on the horizon somewhere. But we keep plodding on and we keep going on. Yeah, thank you, Jared, for that.
Now, for those that may not know, George, can you tell us a little bit about 10,000 Toes? Why is it important, and what is the work that 10,000 Toes is doing in the Pacific?
Well, 10,000 Toes campaign is really an initiative of Adventist Health, and it's being initiated by Adventist Health and with donors who have put in some funds to help fight against the tide on lifestyle diseases that is becoming a plague in the Trans-Pacific Union mission and in the South Pacific. Every 20 minutes, we have an amputation. Every 20 minutes, we have an amputation. And that is staggering. And really, I'm grateful to the church for taking a proactive stance in mobilizing Pacific Island people to be in the forefront of this war against type 2 diabetes and the war against lifestyle diseases. So we rolled out the 10,000 Toes campaign in the Trans-Pacific Union mission about 3 years ago. We rolled it out in a time when there was lockdown for COVID-19, but that never snapped us. We went through by firstly working on the three strategies that we have. We have three main strategies. Strategy number one is to ensure that every village and every community has the ability for self-assessment, where screening kits are distributed to every villages through the churches, through the Seventh-day Adventist churches, so that we can detect lifestyle diseases, especially type 2 diabetes, at an early stage. So we can arrest the disease, we can let the people know, and we can also tell them what to do and where to go. So we go out screening in the communities, and we have referral pathways where they are referred to. If they have too high a risk, we try and get them to the hospitals. And for the medium and the low risk, we have lifestyle intervention strategies. That takes us to our strategy number 2, is that where we train the local church members, the local people, or the local community members to become lifestyle coaches. So we train them in lifestyle intervention programs that are being put out by the church, that are being put out by Elia Wellness, and they become lifestyle coaches in their so-called wellness centers or wellness hubs. And the wellness hubs are the churches or community halls or anywhere there is health activity taking place. And the third strategy is to equip and upskill our health professionals, our nurses and doctors, so they are more aware of lifestyle medicine approaches, and they have an alternative that they can administer with their patients that have lifestyle diseases. So we've worked those 3 main strategies throughout the Trans-Pacific Union Mission. We have people on the ground that are called ambassadors. These ambassadors, they're really the hands and feet of the 10,000 Toes campaign. They're out in the communities, and we have about 5,000 ambassadors throughout the Trans-Pacific Union Mission. They are all volunteers. They're out there doing the work out there. And the ambassadors work in zones. So we form zones where they have a sense of belonging to. And this year, our main theme is to go wide and go deep. I think we've gone wide enough when we have covered all our island nations. And now we're working on getting a lot more deeper in how we can address lifestyle diseases. Yeah.
Awesome. I love how you're equipping locals to coach and teach on this, because it's such an important issue. I guess I'm wondering where the name 10,000 Toes came from. Can you tell us about that?
We've always wondered where the name came from. I understand that the old South Pacific Division health director, Chester Puma, came back from the Solomons on a holiday, and was in the office with a couple of our people down there. I think it was Paul Rankin, and with Pam, who is now heading the 10,000 Toes campaign. And he was sharing with them how sad he was when he went to the Solomon Islands for his holiday, and he lost his cousins and brothers and friends from this dreaded disease. So from that little chat around morning tea, they managed to come up with the idea: if we can save so much, $1 million or so much, we'll be able to save 10,000 toes. So that's where the name 10,000 Toes came from. It's an idea put together. It's a campaign put together. We're getting people involved. And I like the campaign because it is a grassroots campaign. It involves people from the grassroots and working its way up and through the communities. Yeah.
In the societies that we live in, George, people might not think that diabetes is such a problem. They might think that that's just the thing where you can't have sugar or you can't process sugar, so you shouldn't eat too much sugar in your life. But you're talking about amputations. So can you tell us some of the some of the fallout from unmanaged sort of lifestyle diseases. What kind of health impact is that having, and how widespread is that problem in the Pacific? Because we tend to think of it as a Western disease in some sense, and it is rife in Australia and New Zealand. This type 2 diabetes, particularly, is becoming more and more common. And yet in the Pacific, it's a very big problem. Can you give us an understanding on the scope or the size of the problem?
Yeah. Jared, we never used to have diabetes 30, 40 years ago. Uh, One of the biggest factors is the changes in lifestyle amongst the Pacific Islanders. We have changed so rapidly in the past 20 years or so with many imported foodstuff, with a lot of people traveling in cars. You're not walking anymore. And our culture has never helped us. We're a culture of people that live around food. We celebrate with a lot of food. And even in our churches, I think one of the biggest contributing factor to what we call NCDs, non-communicable diseases, is our church potluck get-togethers. They not only in Seventh-day Adventist Church, but also in other churches. So culture is one of the biggest issues that we try to overcome. We have adapted to the Western way of living. We have employment. We have jobs that we could go to and earn money, and do not have time to go to the gardens. And we see this when we go out to areas outside of the urban areas, and when we get in records of assessment and health screenings, we find that out in the areas with the sugarcane farmers or the farmers in the rural areas, the rate of diabetes is a lot lower than as you move into the urban areas, as you move into the towns and cities. And unfortunately, a lot of the people are drifting with urban migration. A lot more people are becoming part of this social problem. That's where we're having the increase. And we're also not addressing this. There's a lot of ignorance, may I say. There's not enough education. And when they do have diabetes, there's not enough care. And I think this year's theme, diabetes theme, is a good one, and that is access to diabetes care. If not now, when? When are we going to have access to, if somebody's starting to develop a little sore? What kind of education does he need? How can he take care of that sore so it does not develop to a fully blown a sore that it warrants amputation? So there's a lot of these factors playing in, and I think education goes down to one of the biggest issues that has contributed to the explosion of the diabetes rate in the country. And it's becoming such a thing now that that it's no longer something that people would be scared about. It's becoming like a daily occurrence that people are so used to it. So the 10,000 Toes campaign is really bringing this to the forefront, working with the Ministry of Health and with the other NGOs in saying, hey, we have this, even though we don't have the capacity to answer all the problems and to solve all the problems, but at least we can help in bringing people to a better, healthy lifestyle. We can help through education, and we can help through sharing lifestyle issues and better living habits. Yeah.
It's interesting that you say diabetes is fairly new to your country. I understand that often when people think of diabetes, they think it's related to sugar and carbohydrates. And I think Japan as well. Japan hadn't even heard of diabetes until like fast food was introduced, which kind of shows like it's more complicated than just like sugar. But it's probably important to just digress where we're going for a second because, and I guess look at the difference between like diabetes type 1 and diabetes type 2 and the other types, because some are lifestyle related, as I'm aware, and then some are genetic or some are due to other things. Can you explain that a little bit?
Yes, Anita, I think when we're talking about 10,000 Toes campaign, we are addressing type 2 diabetes mostly.
Okay.
That's what we are addressing, type 2 diabetes or lifestyle diseases. As you've said, the other one, type 1 diabetes, we don't, although it's increasing, but right now it's not an issue in terms of problematic areas when it comes to diabetes. Most 90% of diabetics are type 1.
90%. Wow.
Yeah.
That's a lot.
And so people, just to paint the picture, George, people are dying young. They're getting blindness. They're losing limbs, as you said, limbs, fingers, toes. In the tropical islands, people in Australia and New Zealand may not understand. In the tropics, when you get a sore, it can be a lot harder to heal. And diabetic patients sometimes have a decrease in circulation, so they don't heal to the point where it gets either infected or gangrenous, and that's why the amputation occurs. So, some of these lifestyle, it really can impact and debilitate the person who gets the disease. And I imagine it's costing the government quite a lot to deal with some of these things in the health system. I understand 10,000 Toes and Adventist Health is partnering with governments because they've seen it in the Pacific as a big problem. Can you tell us a little bit about your work in that space, in the public health space?
Yeah, diabetes complications, as you said, it stems from poor care, poor diabetes care. So when you have a lot of amputations, it's showing something that they have not been managed properly. And the easiest thing that the hospitals can do is amputate them. When there are alternatives that they could try, like changing lifestyle, change of diet, exercise programs, and proper care. Um, as you said, we have a lot of young people who are now being plagued by diabetes type 2. And as I said before, diet has been one of the major causes, plus change in lifestyle from an old active lifestyle to a lot more modern lifestyle where people prefer to live more modern lifestyle. So one of the greatest things I've always said is education. We need to educate, and need to educate. And we also need a lot more stakeholders on board. We need governments to implement some policies that has to do with taxes on food, on cheap noodles, taxes on cheap canned fish. Sometimes they say now it is cheaper to eat rice and noodle than to eat fresh taro and fresh cassava and our fresh foods. So that's another factor. And of course, we need to address irresponsible advertising by companies. We need to look at the schools. Need to stop Coke companies, enticing children to drink more Coke in the schools. We need to change the school lunches. We really need to get a lot more people in our society of various communities coming on and having their hands on board and be part of this big program. But the 10,000 Toes, As you may know, we won an award with the WHO last year, having the best health program in the villages in the Pacific, and I think we were happy with that. And as I said, this year we're just looking at programs that we can go deeper in terms of how can we impact the life? How can we take a person on a wholeness and wellness journey from the beginning to the end, looking at our 7 dimensions of wellness, and not only physically, but emotionally with all our emotional programs, mentally, and also spiritually. So at the end of the day, we can say, yes, we've been successful in changing people's lives, changing people's habits. We can do a lot of screenings, we can do a lot of identifying of people at risk, we can send a lot to hospital, but at the end of the day, what have we done to change a person's life? Uh,
Mm.
change, and he becomes a new person holistically.
Yeah. I wonder if you can educate us a little bit. You've mentioned a few times lifestyle diseases, and you've mentioned the importance of what we eat. But I think when a lot of people look out into the world, there's so many different messages about the ideal diet. There's like the keto diet, the low carb diet, the high carb diet, the whatever. Like there's a million different kinds. When you speak about a healthy diet as a way of avoiding type 2 diabetes, what exactly do you mean? Like, what is the ideal diet that we should be eating so that we don't end up with diabetes?
Well, for us in the Pacific, we just need to go back to our original diet in the Pacific. Our original diet was basically a plant-based diet. Food is grown. Food is
Mm.
grown, meaning very little processed foods. Food from the garden, straight to the plate. I think that's the best diet that we all know is the best not only for diabetes but for other lifestyle diseases also. And we should also take into consideration the other factors. Sometimes we tend to focus on a lot on diet, and we forget about the importance of exercise, the importance of moving irregularly. That's one of the biggest causes of diabetes is obesity out
Mm.
here. Of the 10 countries in the world that rank the highest, 8 are from the Pacific Islands. 8 countries. The
Wow.
only two, the only two are America, USA, and Kuwait. The only two.
Hmm.
The other 8 are from the Pacific Islands, and
Wow.
we are a nation of obesity. And obesity, definitely from these two factors, from consuming the wrong food in great quantities, and also for not moving, for being, just sitting down, not doing exercise. So we become a nation of obesity, we become obese people, and that, of course, translates into diabetes and other lifestyle diseases. And we should also be looking at factors like alcohol, factors like cigarettes, factors like sleep and rest. These are major habits, and I know there's been a lot of studies that have shown Adventists that live the longest is because they practice a lot more better habits than the other people. So it's a matter of practicing the habits that's important. We know what the habits are. There's 4 very simple habits that we try to address: food, exercise, alcohol, and smoking. And if you take away 2 of those, at least 2 of those, you would have. It has been proven to have to give you a longer life. But when you're talking diabetes, food is also a very important factor. And for us in the Pacific, we just need to go back to where we used to be and what we used to eat. And I'm happy that the government is looking at that now with the South Pacific commerce. They're looking at ways in how we can replant our food, get our gardens, and cut down on importation, on processed foods, and try to consume healthier foods.
something that really struck me, George. I was in the highlands of Papua New Guinea. They flew us out right over near the border with Indonesia, and on the plane, one of the little planes came in. These little airstrips in the bush, the little plane, and they must have unloaded. I think someone counted there were 90 to 100 boxes of Maggi 2-minute noodles. So these were not to put any brands, I guess, in it, but just these processed instant noodles. There were just so many boxes, and as you said, it's cheap, it's more accessible, and you would think in the highlands they wouldn't have access to that kind of thing. But this whole plane, it shocked me. I was shocked. So people may think this, how can it be an issue in some of the remote areas? But it's spreading right over the world, this problem. So it's a concern, but yet we're seeing good results. So can you tell us, I'd love to hear if you've had any stories in terms of people that have worked with Adventist Health or 10,000 Toes and seen either improvement or avoidance or reversal of some of these health problems that they've seen that has impacted their life. What have they done, and do you know any sort of examples that you can share with us in showing us that this is actually working? The interventions that your ambassadors and that your coaches are teaching and encouraging the people with are actually making a big difference.
Yeah, we try to measure that with measured results. That's one of the measuring stick outs that we use with actually how blood sugars come down, how they have gone off medication, and how they continue to come into the wellness hubs, and they continue to come into Hope Clinic, and they continue to be part of what we call the health clubs that we form. So it's after the intervention program, there are health clubs that they go into as because it offers sustainable programs for them to continue. And we've had so many remarkable stories on what has happened. And we try to share these impact stories with on a newsletter. And I think the 10,000 Toast newsletter every now and again comes out with impact stories. And in Fiji, we just had one impact story of a lady nurse who herself committed her life to helping the people in her village live or change their way of life. And she actually wanted to go a step further. Instead of just being instead of just experiencing changes herself, she's gone a step further to try and help the people there in establishing a wellness hub for them. And these were all neighboring communities, neighboring communities. So she went and worked in Australia, and she is all her savings she saved, and she came back to Fiji and started off building on the wellness hub. And she came to 10,000 Toes and asked 10,000 Toes to help, and we've helped her. So, that's an impact story of somebody who's really felt the impact of change in their lives or in her life, and she's wanting to impact others in their village, which are very far away from the hospitals. She talks about crossing the river 22 times to get to the nearest health station, or hiring trucks in the middle of the day just to get down to hospital. So these are impact stories for people that have experienced goodness and changes in their life. And we continue to experience these. We continue to record this in our records, because in 10 years' time, we need to show, one of our major objectives is to see a downturn in diabetes. So how do we see a downturn in diabetes? It's just by measuring the results of what we do throughout a period of time. So we've had positive results. It's not as quick as we would want to, because the biggest problem here is changing habits. It's not easy to change habits. It's difficult to change habits. It's very difficult to change habits. That's why the people have to own the program. They have to be part of it. They have to take ownership of it. If it's from the 10,000 Toes people, they'll come and they leave, and people go back to their old way of life. So we are trying to ground them that they become that this new way of life is part and parcel of how they're going to eat, how they're going to exercise, and how they're going to live during the rest of their lives. Yeah.
Yeah, awesome. It might be slow, but slow and steady wins the race. So it's good to hear that you're at least making progress in that area. Just quickly, we have almost run out of time, but before we go, if there is someone listening to this, what are some kind of red flags for them to look out for in terms of like if they might be at risk of diabetes? Can you just give some of those so that people know like if they need to, when they might need to go see a doctor or when they might need to start making changes to their life?
Yeah, diabetes, as we say, is a byproduct of fat in the body and an accumulation of sugar, and naturally the body would want to get rid of the excess sugar. So how does it do it? It wants you to go to the bathroom quite often. You go at unusual times to the bathroom. Often it could be a sign that your body is struggling with sugar, and also you could come with a lot of itches in your body, unusual itches, unusual inflammation on the skin of your body. It could be a sign of diabetes, and of course, sores that are taking longer to heal. Parts of the body. You might have a blister or something, and it's not healing as well as it's supposed to be. After all that you've done to it, and it's still very slow in healing, it could be a sign of diabetes. And of course, if it's advanced, your eyes are not reading well. You're not. You have blurry vision. It's affecting your eyes. But I think the most common one, usually it's in the body, and not many people realize that their blood sugar is out of whack, and they need to be checked. They need to be checked with it. Often thirsty. You try. You have an unusual thirst. You want to drink all the time, and it's usually a drink of fizzy drink that you crave for, and of course, unusual hunger too. You get hungry quite often. Yeah. Those are some of the few signs we tell people to look out for. Yeah.
Great.
Otherwise, you go to the nearest 10,000 toes wellness hub, get a check done, and they can tell you.
There you go.
Yeah, that's great, George. I guess prevention is always better than cure, and that's part of the education work that you guys are doing. And it's a fantastic work, and we've put the 10,000 Toes website in the comments. So if people want to find out more, they can go to the website. They can sign up to your newsletter to see what 10,000 Toes is doing right through the Pacific. Thank you for joining us today, and God bless your work there in the Pacific.
Yeah.
You're most welcome. Thank you for the opportunity to be here and to share. Thank you very much.
And for our regular watchers, listeners, viewers, we will see you next week.
Awesome. See you later.